Okay friends, welcome back to Case of the Week. I got a good one for you today. This is a woman who came to me for jawline definition. Now it's a very popular subject right now, jawline definition. Everyone's doing fillers, but you know, not everyone is a great candidate for filler in the jawline. A little bit goes a long way, but a lot, which you see a lot on Instagram, social media now, people are like loading up the jawline way too much, and it's making people who have heavier chins and jowls just look wider and fuller in the face, and it's not really a good look. Often with many things, combining several small amounts give an overall great result. So before I did anything for this patient, I wanted to do something to lift and suspend the tissue. I did not rule out filler, but in this case I actually used some Suspension PDO threads, barbed Suspension PDO threads. You see me do a lot of thread lifts on Instagram. And this was a patient who I thought had a few concerns. Obviously, they need a little bit more definition in the jawline. There is a little bit of excess fat in the submental area and in the jowl. There are some lines here. Now, instead of just selling her the quick fix that's going to not really make her look good in the long run by putting in the filler, I decided if we're going to do filler, let's do that last. What I first wanted to do is shift the tissue. I did place a few barbed threads here, not only in the jawline, but in the area of where the necklines are. Now, normally I would use a little filler for the horizontal necklines, but if you place the threads in the same plane, you're not only getting suspension, but you're getting some collagen development to give almost like a filler effect. So this is just placing, I don't know, I believe about 4 or 5 suspension sutures. You can see a nice definition here. It almost looks as if like the submental fat was relieved. But what I'll probably do in the future for someone like this, just to give her that perfect snatched result, is maybe do a little Tumescent Microcannula Liposuction, a simple half-hour procedure, remove that fat pad. I could add a little bit, I like Radiesse in this area. It's a natural precursor to bone and cartilage, so it goes great over bony prominences. It lasts a while as long. And between that and maybe a little fine line filler to finish up there, she could really have almost a dramatic surgical result by combining several small things. Again, this is a perfect example is that there is no best treatment for a patient. You often have to find a combination of small things done in the order of priority to give the best result. So here we just had such a great result here. The patient thought they were going to just get filler. I did the suspension threads to last 12 to 18 months. I will then finish up, do a little submental fat removal, a little bit of Radiesse here, and maybe a little Belotero in the necklines. And you're really going to have an ideal result that does not look like she's had anything done and is just 𝗶𝗵𝗴. So we'll see you soon. Case of the Week.